One of the first medications approved to lower cholesterol were bile acid sequestrants, also known as resins. Cholestyramine, sold under the brand name Questran, has been around for over 50 years. They work by decreasing cholesterol in a totally different way from statin medication. In this video, I will explain everything you need to know, especially what it does to the body and about specific side effects. I'm also going to answer questions from my clinics at the end of the video, such as what's the difference between statins and resins and can they be used together? Is it true they can also be used for diabetes? These are really important questions that you should be fully informed about when making a decision about taking your medication. So let's get started with how do they work? These medicines work by blocking bile acid in your stomach from being absorbed in your blood. Now, bile acids are crucial for the body's digestion process. Because of this, your liver then needs the cholesterol from your blood to make more bile acid, so this reduces your cholesterol level. Now, do note that changes to diet and exercise are often combined with this medication, and this medication may be used for other purposes, which we will talk about a little later. There are 3 different types of these medications. Number 1, as mentioned at the beginning, there is cholestyramine powder under the brand name Questran. Number 2, cholestyramine, known by its brand name Colestid. Number 3, Colestyramine, and its brand name is Colestogel in Europe, Welchol in the US, and Lodalis in Canada. So how well do they work? They have been shown to lower cholesterol by 18 to 25% at higher doses. They have no effect on HDL cholesterol, also known as good cholesterol, but they may cause a rise in triglyceride levels, but your doctor will monitor you for this. So who can and cannot take them? Now tell your doctor if you have any of these conditions: blockage in your bowels, high cholesterol, history of pancreatitis, low levels of potassium in the blood, an unusual or allergic reaction to resins or any other medications, if you are pregnant or trying to get pregnant, or breastfeeding. So how do you take them? Cholestyramine and cholestyramine are powders, so they are usually mixed into a liquid or soft food such as fruit juice, skim milk, soup or yogurt. Take Colestyramine tablets after some food, such as a snack or meal. Swallow the tablets whole with a drink of water. Don't break, crush or chew the tablets. So what are the side effects? Side effects that you should report to your healthcare provider as soon as possible are allergic reactions such as skin rash, itching, hives, swelling of the face, lips, tongue or throat. Bowel blockage, such as stomach cramping or unable to have a bowel movement or pass gas, loss of appetite or vomiting. Or pancreatitis, which is severe stomach pain that spreads to your back or gets worse after eating or when touched, fever, nausea or vomiting. Side effects that usually don't require medical attention but do report to your healthcare team if they continue or are bothersome are constipation, nausea, runny or stuffy nose, a sore throat, or upset stomach. Now, this list may not describe all the possible side effects. For a full list, see the leaflet inside your medicines packet. So what are the cautions with other medicines? These include cyclosporin, some hormones, insulin, certain medications for diabetes, certain medications for seizures, metformin, olmesartan, thyroid hormones, verapamil, vitamins, or warfarin. So this leads us to the questions asked in my clinic. Now, I would like to highlight that this is part 7 in a series of videos exploring different cholesterol-lowering options. Be sure to check out the videos on statins, ezetimibe, bempedoic acid, PCSK9 inhibitors, Vascepa, fibrates, and inclisiran. So what's the difference between statins and resins? Resins are the oldest and safest cholesterol-lowering agents, but are not as strong than other medicines now available, like statins, and are not always well tolerated due to the side effects. The main difference is how resins work in the body, which I mentioned earlier. They reduce high cholesterol by removing bile acid from your body and decreasing the amount of LDL cholesterol, also known as bad cholesterol, in your blood. Now, statins work by getting in the way when your liver is trying to make cholesterol, and this is explained in my video about atorvastatin, which I will leave a link for down below. So can this medication be taken with a statin? Colestyramine has fewer interactions and can be taken alongside other medicines such as statins and ezetimibe. But not the powder. The powder can interact with other drugs, so you need to take it on its own without other medicines. So can it be used for diabetes? Yes, it may also be used to treat type 2 diabetes. It works by decreasing your blood sugar level. Colestyramine, brand name Welchol, is approved in the US. It's not absorbed into the bloodstream, making it a safe option for patients with kidney or liver disease, heart failure, or long-standing type 2 diabetes who may not be able to tolerate other medications for diabetes. So what else are they used for? These medications can also be used to treat itching caused by liver disease because they help remove substances that make the itching worse. Since they're not absorbed into the body, they don't cause liver damage. However, they can stick to vitamins, hormones, or other medications in the intestines, which might make those less effective. Now, I hope you enjoyed this video, and please share your thoughts or experiences in the comments section. And you can also check out my other videos, including the cholesterol medication playlist. Thank you for watching.